Hi, Bother Brigade. Here's what's bothering me today.
First of all, we do have capacity in our hospitals, and the Science Advisory Table has basically indicated that it appears that the peak of Omicron has passed. That doesn't mean we're entirely in the clear, of course. We still do have high levels in both our hospitalizations and intensive care units. However, that is starting to decline. This week we've had about 3,000 people admitted to hospital. Last week it was over 4,000. We have capacity. That's why we're doing things like releasing Directive 2 somewhat to allow for some of those procedures that people have been waiting for some time to continue. We're opening up pediatric surgeries, cancer screenings, making sure that we can let independent health facilities operate, private hospitals. All of those things are possible because we do have the capacity that the Premier mentioned. We have created over 3,100 hospital beds, over $5.1 billion, 67 new healthcare professionals into our system, so that even if the numbers do go up slightly as we start opening up, the modeling has been done to indicate that we will still have the capacity to deal with that increase, but also to start to deal with the people who have had procedures or surgeries postponed. So we feel that we are ready for whatever will happen as we move forward.
Did you catch it? If not, here's what we're talking about today.
Making sure that we can let independent health facilities operate, private hospitals.
Yeah, so, while everything terrible has been happening both in Canada and the world, let's be honest, good old Doug Ford, who's for the people, decided to do some really sneaky shit. That was Ontario's Health Minister, Christine Elliott, on February 1st, basically saying that they are allowing for private, for-profit hospitals to be a thing in Ontario. Now, the Ontario Health Coalition has a really good breakdown, so we're going to go through that because they are the people fighting back most against this, which is why they should absolutely be getting more of our support and attention. And also, shame on the media for just completely missing this. Like, I know there's just, terribleness happening in Ottawa and elsewhere, but at the same time, I feel like this affects all of us, right? And it's just reminding me of something else that I kind of want to make a video on, but it's like so many video ideas, so little time. But anyway, with regards to this story about the privatizing of healthcare in Ontario, here's what they have to say. The media missed it, but it is a bombshell announcement. It means for the first time since the inception of OHIP, an Ontario government would bring in US-style for-profit hospitals. Under Ontario law, new for-profit hospitals are currently banned and have been since 1973. We're going to need to do so much work to undo all the shit fuckery of Doug Ford. Doug Ford's plan is a disaster. The for-profits do not have ICUs. They don't run teaching hospitals. They don't have sound oversight and quality of care regimes. They take as much profit out of our healthcare as possible, just like for-profit long-term care chains. Yeah, those of you here in this audience remember how I made a few videos back in the day, like in the earlier days of the pandemic, talking about the absolute horror show that was long-term care and the COVID outbreaks there that were killing thousands of grandmas and grandpas, and how it got so bad that the military had to be called in at one point to help. And it was so traumatizing. The military people needed, PTSD counseling because of what they saw and how horrifying it was because, profit over people, right? So yeah, I'm sure this new plan is going to work out just fine, right? To maximize profits, they charge an array of user fees and extra billed patients on top of OHIP, undermining the foundational principle of public health care, which is to be provided to all Canadians based on their medical need, not their wealth. And devastatingly, the for-profits take only the lightest, profitable surgeries and diagnostics, and the funding and staffing resources that go with them, leaving our public hospitals with less funding and staff to care for those with more complex care needs. And then the final tweet in that thread was about an emergency meeting that they had back on February 15th. But unfortunately, that's just conservatism, right? They always do stuff that no one who voted for them goddamn asked for, right? It's never like, oh, you know what? The people said they actually want us to cut healthcare, so we're going to do that. No Canadian really wants that except the most wealthy and selfish among us. And it's just so absurd, right? Because that's what governments do. They get into power, unfortunately also with the majority government like Doug Ford has in Ontario, and they just kind of do whatever they want. And they sabotage things to make it seem like, oh, look, see, now we have no choice but to let private industry do that. I think they did that, I think in Saskatchewan or Manitoba, where, oh, look, I know we kind of didn't do anything to stop the viral spread of COVID. That's why we need to let private clinics exist now. You know, come on, it's just so clear. Please ignore the fact that I basically ensured that this situation would arise and took no precautions against it. Please don't talk about that. And again, want to stress, right? This is after the goddamn things have been banned since 1973. We are looking at nearly 50 years, half a century of this stuff being banned. And here it is being brought in by the Conservatives, especially under the Conservative Premier, who's, you know, for the little guy, and he fights for the working class, and he's all about them hard-working folks and all of Ontario, right? Which is why he's doing this, which is negatively going to impact those people he has the audacity to pretend to care about. So instead of what's going on in Ottawa and over in Europe, specifically Ukraine, and other stuff going on, I haven't even talked about the massive strike that's happening in Haiti yet, right? So there's a lot of stuff going on, but I felt that crucially, since no one else in the media, which is already not doing a good job reporting about the fascists in the convoy right now, it felt very important to me that I bring up the just open and brazen declaration of, yeah, you know what, we're going to have some for-profit hospitals and facilities now here in Ontario, even after they've basically been banned for 50 years, and it's not anything that Canadians in this province asked for. And it was not in their platform that they were going to do this. This is just Conservatives putting the emphasis on that first little part of their name, right? It's all a fucking con with these people. And unfortunately, lots of people still don't realize that, and these jackasses are still in charge until the upcoming Ontario election. And unfortunately, Doug still has a chance of winning. Maybe not a majority, but still possibly a minority. And that fact alone should scare all of us, and it's definitely what's bothering me today.